Did you go out skiing recently and felt a painful pop in your knee and your doctor thinks you may have torn your ACL? Whether or not you have been officially diagnosed with imaging, you are probably wondering, will I need surgery? If living free of pain equates to a better life for you, keep watching and find out what you can do to live your best life. Welcome to Better Mobility, Better Life, where you can learn how to break mental and physical barriers to become a better athlete, a more functional human, and how to age with grace using physical therapy techniques. Hey friends, it's Dr. Lindz, and in this episode I'm going to talk about how recovering from an ACL injury does not always mean surgery. With the right exercises at home, you can strengthen your knee, protect your joint, and get back to the activities you love. In this video, I'll guide you through the essential non-surgical ACL rehab exercises you can start today. Please note that this information is purely educational and is not medical advice. I myself have had 3 ACL tears, and I actually ended up re-tearing one of the previous surgical repairs. I strongly suggest that even though I did have to go through surgery, you work with your medical team, whether that's your surgeon and your physical therapist, in order to see if you can do a lot of these exercises prior to surgery, because that will help tailor your program and see if you actually really do need surgery. I've known patients to go through a rehab program and not ever have to go under the knife. So it's really, really important for you to give it a try, and also, the stronger that you would go in if you do need surgery, the stronger you recover and the faster you recover. So it's just very, very important for you to try these first with a medical professional, and then you can decide what following steps you need. All right, so what is the ACL? The ACL, or the anterior cruciate ligament, is one of the key ligaments stabilizing your knee, and it connects the femur to the tibia, so your thigh bone to your shin bone. The ACL prevents the tibia, or your shin bone, from moving anteriorly on that femur. A tear occurs when the tibia translates anteriorly on that femur, and it also goes into a little rotation. This can happen from a traumatic blow to the knee, maybe a slip and a fall, or if your muscles get fatigued and they're weak, specifically the hamstring muscles, because they do prevent the anterior translation of the tibia and the femur, then you can tear your ACL. For this last reason, studies have shown that most ACL tears during downhill skiing happen after 2 p.m. because your muscles aren't firing as quickly and they're very fatigued. With an ACL tear, your knee can feel weak or unstable. You may have instability episodes where if you stand and you twist on that leg, the ACL is no longer there to support your body weight and your knee may buckle or you could fall. ACL tears do occur more in the female population due to the structure of the female pelvis and hips. Also, females tend to be more quad dominant, where males tend to be more hamstring dominant, and that gives them a little bit more stability with that knee. With targeted exercises, we can improve strength, stability, and function without surgical intervention. Please note these exercises are not for you if you've already had surgery. If you have had surgery, you need to follow the protocol that your surgeon and your personal physical therapist provide for you. Okay, so here are the exercises before surgery. So the first exercise we're gonna do are called quad sets. And what you're going to do in the seated position, you can bend your other knee if that's comfortable for you. And you're going to tighten your quadricep muscle, your thigh muscle right here. And you may notice that your ankle lifts slightly up off the mat or the floor, wherever you're at. I'm gonna have you hold this for about 5 seconds, and then you're gonna relax. And I would like for you to do 3 sets of 10, and if you can do this 3 times a day initially, that will really help to strengthen out that quad. The problem is that after any sort of injury, if that knee starts to become swollen and inflamed, it will actually shut down your quadricep muscle. So this is one of the key exercises just to make sure that that muscle starts to fire for when you're standing and walking. The second exercise that I'm gonna have you do, again in the seated position, is a heel slide. And basically we're working on the range of motion for that knee. So again, if you are swollen and there's more fluid in that knee, it may be a little bit harder for you to bend because everything is competing with that swelling for joint space. So what you're going to do is you're going to just try to bend that knee as much as possible and bring that heel back towards your bottom. And then you're going to push it back straight out again. So here I would do 10 of them at a time, depending on your pain level. And if you can do this again 3 times a day, just working on that mobility and that range of motion of that knee, that will help. Okay, and then the next exercise I'm gonna have you do is in the same position, and this time you're just gonna bend your knee up to a comfortable position. This is called a hamstring dig or a heel dig. And you're going to pull that heel down into the mat. So you're activating those hamstrings, and you're gonna hold for 3 to 5 seconds and then relax. So again, you're pulling down into that mat, activating the hamstrings, and then relax. So this I would do 2 sets of 10 at a time. Again, if you can do 2 times a day just to really get the hamstring strength staying there, that would be perfect. For the next exercise, you're going to grab a towel and roll it up just like this, and you're going to place it underneath your knee and sit back, and what you're going to do is contract that quad muscle and try to straighten your knee as much as possible. So your ankles should come up off the mat, and I'm gonna have you hold for 5 seconds and then return back to normal. This is called a short arc quad, and it really helps to activate the quadricep muscles again. And sometimes this is a little bit easier to do than the first exercise, the quad sets. So you can start with this one. With this exercise, I would do 10 of them at a time, and again, try for 3 times a day. For the next exercise, it's called a straight leg raise, and I'm gonna have you lie down with this one. Keep your opposite knee bent, and you're going to, again, activate that quad, make it nice and tight, and you're going to lift that thigh up. I don't want it to go any higher than your opposite thigh. Hold for 2 seconds, and then come back down. So again, activate the quad, lift up, not too high, and then come back down. And each time you come back down, I want you to relax that quadricep muscle because it can fatigue very, very easily and quickly. So if you contract that leg or that quadricep muscle and you lift up and you notice that on the way down, your knee starts to put a little bit of a bend in it, then that means that your muscle is fatiguing. So really try to hold that quad as tight as you can, and you might have to lower that height and then bring that leg back down, keeping it as straight as possible. So for this, start out with 10 repetitions, and I would do 3 sets of it. And if you can do this 3 times a day, again, that will help to really strengthen out that quad and keep the endurance of the quad going. All right, for the next exercise, it's called bridging. And what you're gonna do with this is really work on the strength of your gluteal muscles. So you're in a hook line position with your knees bent, and if you're having a lot of problems bending that affected knee, just put that leg wherever it's comfortable. And what I'm gonna have you do is just tighten your abdominals slightly, and you're just gonna lift those hips up off that mat, squeeze the glutes or the buttock, and then come back down. So if you can hold for about 3 seconds at the top, that's ideal. Coming up and then back down, and I would recommend doing 3 sets of 10 with this. If you start getting a lot of pain in that knee, or you just can't bend it this far because you have too much swelling, just hold off on this until you get a little bit more range of motion. For the next exercise, you're gonna be lying on your side, and this is called side lying hip abduction. What you're gonna do is you're going to engage that quad, keep it nice and tight, and I'm gonna have you lift that leg up in the air. It doesn't have to be extremely high, and just make sure that you're lifting it straight with your torso. A big common mistake is for people to use more of their hip flexor and come forward with that leg. So if it helps, you can get against a wall, that can be your guide, and you're just gonna lift that leg up and come back down. So I would start with 10 times because you might get pretty fatigued in that hip, but ultimately work yourself up to 3 sets of 10. And if you can do this twice a day, that will really help to keep your hips nice and strong. Definitely do it on both sides, just because the way that you're probably compensating with how you're walking, you want to make sure that you keep everything even. The next exercise is a great exercise to strengthen all the little muscles and your calf muscles in your ankle joint. It's called a heel raise, and you're gonna start with 2 feet at first. You're going to come to your counter or your kitchen table, something nice and sturdy. You can use your fingertips if you need to. If you can do this without using your hands, then you'll be basically testing out that balance a little bit more. And what you're gonna do is you're gonna lift your heels up in the air, hold for 2 to 3 seconds, and then come back down. I want you to try 10 at first. If this feels easy, you're gonna progress to 2 or 3 sets of 10, and you should start to feel a good little burn in your calf muscle, maybe in the bottom of your foot as well. The next exercise that we're going to do is a little bit more advanced. So if you are fresh after an injury, I would suggest holding off for maybe a few weeks or wait till that inflammation goes down before you try this one. It just adds a little bit more instability. So this one, we're gonna be working on our hamstrings again. If you have a ball at home, I'm gonna have you put your feet up on that ball, and you're going to go up into a bridge. You can start here. If you feel pretty stable, then what you can do is you can bring that ball back towards your hips, and that will work the hamstring. So you might need to lower back down, let everything relax, and then come back up into that bridge, pull back, come back down, relax. When you get strong enough, you can come up, and then you can do 10 hamstring curls in a row. 3, 4, 5, 6, 7, 8, 9, 10. It's a pretty big burn, so you might need to just start with, 5 or 6 at a time. Here are some tips for safe ACL rehab. Move slowly and focus on controlled movements. Avoid any sharp pain. Mild discomfort is okay, but stop if it hurts sharply. Perform these exercises twice daily and gradually progress your intensity. I highly suggest that you seek out a qualified physical therapist in order to help progress your program, as they have different techniques to monitor your strength and your mobility. Non-surgical ACL rehab is all about building strength, stability, and confidence in your knee. Stick with these exercises consistently, and you'll notice better knee control, less instability, and a smoother path back to activity. If this video helped, hit the like button and subscribe to Better Mobility, Better Life, and share it with somebody recovering from an ACL injury. Until next time, move better, feel better, live better.